I posted a video yesterday about a caregiver who has been killed by her patient, and I've realized that in the comment section we needed to do a little bit of education. This video is going to come from a place of love, as I've always done, in a very educative manner. Not to point fingers to anybody, but it's a lesson learned to us all. I've been a registered nurse. I've been practicing for the last 13 years after I graduated from school. And moving overseas here into the UK and practicing here, the UK healthcare system is good. However, if you do not know what you are doing, nobody would come and tell you what to do. That's point blank, period. You have to know the system for yourself, and you have to know how to navigate and safeguard your own self, because guess what? Some managers do not actually care. Since I came to the UK, I've had the opportunity to rise to the level of management in nursing, and I've realized a lot of loopholes. In fact, I can say confidently that some sectors in the healthcare system need thorough cleansing and overhauling. But that's a separate topic for another video. Now, if you're a lone worker, you're going to work alone in the capacity of you being responsible for yourself. There are certain things that you should know, especially if you're working in the mental health, sector, or you're going to look after somebody with mental health conditions. Not necessarily somebody with mental health. In fact, anybody you are looking after, you have to read their care package, their care plan. Okay, so if you're a carer and the nurse who has assigned you, or the manager who has assigned you to look after this person, does not have proper care plan, including risk assessment in place, don't try to go close to the person until you know what the care package says. Now, if you have looked at the risk assessment yourself, assess the situation, because sometimes you are a lone worker, your manager is not there. After you've assessed the situation by yourself, ask, what are the escalating protocols? What should I do in case? In a real situation, let's say the patient started being erratic. He relapsed because maybe he was sober and he was sent home to be looked after at home. But in the process, he relapsed. He became, agitated, aggressive. What should you do? You should call 999. You don't have anybody by your side. You don't have anybody to support you. Call 999. At that point, don't call your... I know you are tempted to call your manager. What if she doesn't pick? What if she's at miles away? What can she do to support? The help you need is 999. Either you are calling the police or you are calling the paramedic. In fact, call both of them, because it is a mental health crisis that this person is experiencing. When I used to work in A&E back in the days, there was a patient I looked after who was 6-1. Yes, some of these mental health patients are 6-1, 5-1, 4-1, 3-1, 2-1, which means that the number of people that need to look after them, 5 people, 6 people, and that is because of how unpredictable their health condition can be. I had a patient, before I was able to give him an injection to settle him, I needed 6 people. 2 mental health nurses and 4 security men. In fact, 2 security men came at first, and they had to call for reinforcement for 2 extra, making 6 men before I could give 1 injection. And so there are certain situations that it's not every job that you just rush and go and accept the job offer. I know sometimes it's out of desperation, you really need the job, but do not put your life on the line. On a night shift, a male mental health patient, 1 female carer. Whoever sent Irene to do that job in that house, they need to be thoroughly investigated as well. That care company needs to be thoroughly investigated. What was their risk assessment that was in place? What care package? What was the care plan? What did they write? What did they tell Irene before she went to put her life down on the line? What training did they give? Some people don't receive training. They are just put on the map to go and work. And I've seen a lot of people accepting to work when they do not have appropriate training. I have worked with carers who have no clue what they are doing. And it is up to you to hold their hands like little babies, to teach them. And it is okay if they're happy to learn, it's fine. But some do not even want to listen at all. They feel like they know. Because some of these conditions, you can't predict them. They can be so sober 1 minute, the next minute they are all over the place, and you are asking yourself, is it this person I was just talking to who is like this? It is their condition. So you have to safeguard yourself. By rights, these people These patients shouldn't even be home to be looked after. They shouldn't be in the comfort of their home. They should be in mental health institutions. But sometimes, because they are okay physically, they take them home. Sometimes also because the families want to keep them home, because it is much cheaper for them, they prefer to keep them home. Sometimes the families also get allowances from the government to look after them if they keep them home. And so because of that little money, and I'm saying this from experience, I have assessed a lot of patients who were supposed to be in care home for placement, and their families want to keep them home because if they keep them home, then they're going to get something little, bonuses, allowances from the government. However, that's my point. Some families are doing excellent, they are doing very well, and they're looking after their family members. Some also have undergone extra training to be able to support these loved ones that they are looking after in the home. There are some patients who do not qualify to be in the home, but some family members will insist to keep them home because of their selfish benefits. And that is why I say that if you, the carer, you are going to go there to look after this person, be careful. For me personally, there are certain jobs I would never do if I was a carer. Home care or living carer, domiciliary carer. I'm not going to anybody's house to look after anybody. But if you have chosen to go to people's spaces to look after them, you should get your risk assessment in place. You should ask, what are the escalating protocols? What should I do just in case of this, just in case of that? And be careful, because you have a lot of people depending on you. You have children, you have family members who look up to you. You should not go and put your life on the line, on the front line, just for your life to be wasted without any compensation, without anything being done to whoever has done anything to you, just because there was no proper assessment in place or no proper support trainings in place. And so that company that took Irene, for that particular job, they need to be thoroughly investigated. It has happened to me before when I used to work in this particular place. They signed me up for trainings that they didn't take me for. And I saw it and I almost sued the company. It was a big issue. We'll talk about it in another time. But some of these people are cutting corners. They want to take you to places just to cut down costs. They know that this particular person is a 3-to-1, is a 4-to-1, but they'll tell you to go alone because you also don't know. If you don't know, please ask. Don't play Jesus Christ to go and put your life on the line for anybody to just waste your life. So safeguard yourself, because you cannot pour from an empty cup. Take care out there, because the world is cruel.